Hello and welcome to India Top Doctor. Today we are back with another episode of the Health Dialogue, and we are going to talk about awareness and prevention of liver diseases. There has been a paradigm shift in the dynamics of liver cirrhosis, and about 10 lakh new patients are diagnosed with it every year in India. Liver disease is the 10th most common cause of death in India as per the World Health Organization. And that is why it is very important to spread the light of awareness over it. So, with that keeping in mind, today we have a health expert with us, Dr. K.S. Soma Sekhar Rao. He is a renowned gastroenterologist in Hyderabad. He's a senior consultant gastroenterologist and hepatologist at Apollo Hospital, Jubilee Hills, Hyderabad. Please welcome Dr. K.S. Soma Sekhar Rao. Welcome to India Top Doctor. Before we move any ahead, can you tell us about yourself?
Yeah, I am Dr. Soma Sekhar Rao. I'm a gastroenterologist and hepatologist at Apollo Hospital, Jubilee, Hyderabad. And I've been working here for the last 8 years. And I promote an organization. I run an organization, an NGO called Save the Liver Foundation, which is mainly aimed at eradication of viral hepatitis from India. So,
that's it. Okay, sir. Sir, as you know, we are here to talk about liver diseases and how to prevent it.
Yeah.
Yeah, so can you tell us about the causes of liver disease?
See, the most important causes for liver disease, most commonly all over the world and in our country, is definitely alcohol. Everyone knows about it. But unknown causes of liver diseases, which can cause damage and progression to cirrhosis of liver, are hepatitis B virus infection, hepatitis C infection, fatty liver disease, which is seen more commonly. At least 30 to 40% of urban population in India, we are facing this problem of fatty liver disease. And if you go to the rural population, at least 15 to 20% of people are suffering with fatty liver disease. So these are the most common causes. And rare causes are autoimmune liver diseases. There are some liver diseases which are seen in children because of genetic defects like Wilson's disease, all those things. So increasing this awareness that early identification of a liver disease can reverse the progression into cirrhosis of liver. And awareness is lacking about liver diseases in India, especially. We see a lot of people who go to a native medication for jaundice or any jaundice which is seen. So jaundice is the first presentation or a precipitating factor for any liver diseases. So if we can catch hold of these people and educate them at that point of time that any type of jaundice is damaging a liver over a period of time, then we can avoid many liver diseases actually.
All right, sir. So for a fact, I know this, but can you tell me why is research on hepatitis B and other liver diseases is so critical?
More importantly, recently we have seen a leap in treatment of hepatitis C. In 2014, only we were able to find out a drug for treating hepatitis C infection. And now today hepatitis C is a curable disease with just 3 months of medications. Similarly, for hepatitis B, still date, there is a lot of research going on to bring a drug where HbsAg, if someone is having HbsAg at this point of time, we don't treat. We treat these patients only when this hepatitis B virus is damaging the liver. So we have medications which are very limited at this point of time for treatment of hepatitis B. And this is only when the liver is getting damaged. But till date, we don't have any medications to make this hepatitis B negative. If someone has HbsAg positive, we don't have any medication to make it hepatitis B negative. This is, for example, in hepatitis B. When we are talking about the other most common cause, alcoholic liver disease. Alcoholic liver disease, there is a presentation in alcoholic liver disease called severe alcoholic hepatitis. And even today, with this in advanced with all these advanced medications and all this advanced medical era, still the mortality in severe alcoholic hepatitis is somewhere around 40 to 50%. That means there is a severe cytokine storm, and most of the time there is mortality in the severe alcoholic hepatitis cases. We need more research to reverse this condition and decrease the mortality and improve the survivability of these patients with severe alcoholic hepatitis. Any liver disease at this point of time, it is reversible only if we identify the damage in F2, fibrosis of the liver in F2 stage. But once cirrhosis sets in, the reversibility of liver disease is not easy. So these people ultimately will go to liver transplantation. So the burden on the society is going to be more, and availability of organs is also very, very less. So if we can increase the research in our field of hepatology, liver diseases, so that we will have some medications to to reverse the liver diseases in advanced stages also, preventing them from cirrhosis. So that's going to help a lot. That is why research is required. Still, further research is required in all these liver diseases, especially, as you said, hepatitis B also.
All right, so you said research is very necessary. But one issue we see with regard to liver disease is that many times studies aren't taking the geographic disparities of the patient population into account. What needs to change to ensure that research is available to those who really need it the most?
Yeah, exactly. So basically, it's all diseases are widely prevalent all over the world, and specific diseases are prevalent in specific regions. So every individual, or I mean, when we are talking about doctors or super specialists or people who are in research, they should be concentrating on the problems which are in their area. So obviously, it can't be globalized. A person who is staying in South India should be researching about the diseases which are more common in those areas. People who are staying in Africa should be researching, or they should be working on diseases which are more common, more prevalent in those areas. So obviously, geographical variation should be there. So for example, previously there used to be only uh, European Association for Society of Liver Diseases. But now we have something called INASL. INASL is a local body for India specifically, and other countries nearby, where we share the common diseases all over. It's in Asia Pacific region. So specifically like that, there should be a body dividing, I mean, geographic based on the geographical location, and research should be done according to the prevalence of diseases in those areas.
Okay, so I really hope that people work on it and this issue gets resolved quickly. Sir, can you tell me about the most common liver disease and its symptoms?
Yeah, most importantly, any liver disease presents with yellowish discoloration of eyes and urine, like jaundice, most of the time. But these things will be present in patients who have viral hepatitis, like hepatitis A, hepatitis B, acute hepatitis B, or hepatitis E. There are some diseases, and even in alcoholic hepatitis can present with jaundice. Drug-induced hepatitis, jaundice secondary to any medications, can cause yellowish discoloration. So this is the most common presentation, and everybody should know that if there is jaundice, the problem is with the liver. There are other subtle symptoms, most commonly generalized weakness, tiredness, loss of appetite, lethargy. All these things should drive any patient towards investigating a liver disease. And sometimes we see severe itching sensation all over the body. This is one of the symptom of liver disease. So all these things should drive someone to investigate for a liver disease. Actually, these are the most common symptoms what we see in liver diseases.
All right, so I just talked about the increasing cases of liver diseases since 2020 happening. Can you tell us to what extent is needed to spread awareness about prevention of liver diseases?
So if we have seen increase in liver diseases in the last 1 to 2 years, it is most commonly non-alcoholic fatty liver disease, or generally caused as fatty liver disease. Fatty liver, as I said, the prevalence is very, very high in urban populations in our country, and even in rural populations, significant numbers of fatty liver disease are increasing. So most of the time, in the last decade, people were talking about fatty liver. People know about fatty liver, but they were ignoring about the disease progression. People say it's okay, it's not a big disease and all. But fatty liver disease over a period of time is going to be the most leading cause for liver transplantations. That means it is going to be the highest cause for cirrhosis of liver in this country. In next 10 years, we will be seeing more and more cases of non-alcoholic fatty liver disease or fatty liver as the cause of cirrhosis. So it is a reversible disease if it is identified at an early stage. Most of the time we see fatty liver disease in long-term uncontrolled diabetics, obese people, even in children. If they are obese, we are seeing fatty liver disease. So if you can control obesity, if you can encourage dietary modification and regular exercise in all these patients, simple modifications can reverse fatty liver and prevent from progression to cirrhosis of liver.
All right. As you know, sir, that the COVID-19 pandemic is affecting everyone, including those of patients with chronic conditions. How is the pandemic impacting the lives of people living with hepatitis B?
Most importantly, even before the pandemic, the awareness of hepatitis B is very, very less. And now,
Absolutely.
because people are talking more about COVID-19 and all, and the awareness programs, awareness things, whatever we have been doing before have come down drastically. So awareness always plays a very, very important role about hepatitis B. And most important thing about hepatitis B here is people who are carrying the virus, they won't know that they are carrying the virus because they won't have symptoms at an early stage. Only when this virus damages your liver to an extent like cirrhosis, then only they present to us. It is already late by that time. So getting tested, everybody should be voluntarily tested for hepatitis B, and encouraging hepatitis B vaccination for everyone in the community is very, very important. Anyway, children who are born after 2011, all of them are being vaccinated for hepatitis B. But people who are born before 2011 in India should be sure that they have taken vaccination. If they have not taken hepatitis B vaccination, all of them should be taking hepatitis B vaccination. And everyone should voluntarily get themselves checked for hepatitis B virus. That is how we will come to know if they are having hepatitis B virus.
That is very useful. Thank you so much for that useful information. I won't take much of your time. Just one last question I have, that as a frontline worker, what are the different kinds of COVID protocols you are taking for yourself as well as for your family?
So most importantly, we have been wearing masks regularly. And whenever we know the patient is COVID positive, definitely we will be wearing a protective gear when we are dealing. Most of the time as a gastroenterologist, we would be required to do an endoscopy or a colonoscopy procedures in emergencies to COVID positive patients. So with all the protective gear, PPEs, obviously we've been doing all the procedures for any patient. And sometimes we may directly see a patient with as I mean who has COVID positive into the OP. So we will be having a 95 mask regularly, so that we may not contract the infection easily. In spite of doing all these things, many of our colleagues definitely had COVID positive things. So to protect the family, whenever we suspect that we are infected, we would be away from the family for the next 4 or 5 days till the symptoms subside or till the symptoms doesn't come up. So this is all we have been doing actually. So everybody, it's not just me, maybe all the doctors who have been working during COVID are doing all these things. In spite
Yes.
of that, many of us got infected, which is part of the work that we have selected. That's it.
Thank you so much, sir. Thank you so much for conducting such a wonderful session with us. We'll meet you
Thank you.
next time on some other interview. Thank you, sir.
Thank you very much. Thank you.
And if you guys want to book an appointment of Dr. K.S. Soma Sekhar Rao, you can do that by visiting India Top Doctors.